evening and welcome to the Baby Bunting Live Series, episode 22. I'm Elise and tonight I've got with me Belinda, who's a maternal child and health nurse. And we're going to be going through some little tips and tricks to help you with baby coming into this winter. You know, it's such a big thing that we're currently, down here in Melbourne, it's quite chilly. So if you're out there and you've got a new little one there and it can be quite overwhelming, we're going to help you through that and just give you some ideas to get through there. So welcome again, Belinda, to our live series.
Thank you for having me, Elise.
It's fantastic to have you here and to help us with this and to help our audience get through some of these different times that they may not have experienced before. So I guess one of the overwhelming things is when we first have our little one, what are we going to dress them in? It can be a difficult decision because you or I know when it's suitable for us to be putting on our, t-shirt when it's nice and warm outside, or we're layering up with our jackets and things like that. So what are some of the things that you can recommend for these first-time parents with their new little one?
I think the most important thing in winter especially is layering. So as we would ourselves, like you mentioned, layering up with different natural fibres that can breathe really well is a great option. So starting with something like a singlet can be a really good start. Or if you'd prefer something like a bodysuit that actually does up underneath, and that way they don't have any skin showing around the middle. It keeps them really extra warm. And then something like a onesie. Onesies are super practical. There's all different styles, so that's one. I really like these ones too because they've got the little flip overs there to create mittens, and again that way your baby stays really nice and warm, and the same for the feet, so they're a really great option. And then layering up and putting on some other accessories as well, so if you're going outside, little booties and hats, and you can just keep layering up. If they're going to bed though, there's some really great little sort of swaddle bags that you can get, and this particular one has little buttons. You might like to explain that a little bit more because there's so many different brands out there, and different weights as well, which are called togs.
So this is our Ergo pouch. Now you might remember we had them on a few episodes ago, so they would love to go through their products with you, so jump back on and have a look at that, because it goes through how you would choose the correct one. So a lot of it is determining what the warmth of the nursery is, so where your little one's actually going to be sleeping, whether it be their day sleep or their night sleep, you want to actually check to see the warmth of it. Now with Ergo pouch they do have a great little thermometer in there, so it gives you the guidance of, if your nursery is at a set temperature, so here we've got 20 degrees there, I could then use the one tog pouch, which is what this one is, and then I would layer them up. So I'd be putting on my little onesie and I would be able to then put on my little bodysuit underneath again. So again, it's about making sure that their core is warm. So just checking on the nape of their neck or even just on the front of their chest, just so that it's feeling warm, but we don't want it to be clammy.
That's right.
Because
if it's sticky or clammy, they're probably too hot.
And you want to take a layer off there. And remembering that with these sort of sleeping suits, swaddles, that's what you're popping them in. There's no need for any extra blankets or anything over the top, you pop them in. There are also different brands such as Swaddle Up as well, which again, they give you the great sort of little design of what you need to wear underneath it. And they have the different togs. So going into quite a cool, heading into winter, here down in Melbourne, Tassie, Canberra, New South Wales, the 2.5 tog is designed for your 16 to 20 degree nursery. And it's a great guide because we can be quite overwhelmed. I know that, when I go to bed, I'm a cold person, so I put on a lot of layers in clothing and in doona and blankets, where they don't have weight ratings for them. So what I might think is appropriate for me could completely overheat my little one if I did the same for them.
We do have to be really careful with the correct heat and temperature for a baby, because we know that overheating is a risk for SIDS. So following whatever products you're buying, actually having a look at the packaging and checking what they recommend And if your room's quite a lot cooler than that, and I know down here in Victoria it probably is without heating, even getting some sort of electric panel heating or column heating and just having it on the lowest setting can sometimes just take the chill off the air as well. It can make all the difference.
Yeah. And that's what it's about, just having that chill taken off it, so that your little one will sleep through with the appropriate. And remember, it's about a safe sleeping environment for them there. So, follow the guidelines of what SIDS recommend, and just make sure that you have got that appropriate sleeping area for them.
We've also got this really clever grow egg that can let you know the temperature of the room just by the colour. And I have to say, it's really handy to know that temperature as well. So there's a few different options for checking the temperature, because we generally don't know the temperature of our rooms. But with a baby, it is pretty important to know.
And so things like the grow egg, but also a lot of the monitors now have a temperature rating on them as well.
Yes.
So it means that you don't have to go to the room. You can actually look on your monitor when you're sitting out, in the lounge room or in the kitchen. You can have a quick glance, you can see the little one, and you can see the temperature, and therefore you don't have to go in and have a look at all. So there are lots of different things that you can do, and different items that you might already have there that you can utilise at that point in time.
Absolutely. Talking about heading out with your baby, I know I mentioned the little booties and things, but a little jacket or cardigan, and there's even some gorgeous little puffer jackets you can get for babies too, which is what we would wear if we went out. So they're all available too. It's just important when you're putting them into a car seat to make sure if they've got a really big puffy jacket that you actually take that off them in the car seat, and the hats as well. So if they've got a little beanie or something on, take it off when they're in the car, just so that because the car's heated, and also so that it doesn't fall down over their face or anything. You can utilise the little mirrors. Some people use a mirror in the back seat so that when the baby's in the rearward position, they can actually see what they're up to there as well.
And it's just, I guess, also remembering that, any hats and things like that, or even if they've got tags around them, that's for adult supervision, just because you don't want any of those cords left when the child is alone.
Yeah, absolutely.
Okay, so we've gone from a wonderful little time to sleeping. They've now hopped up, so hopefully they've slept for you, and then it's time to get up and about, and hopefully you'll be able to leave the house. We know that it can take a lot to get up. You're getting up, you're getting that little one ready, getting yourself ready, then you might have to rechange your little one because they've had an accident, and then you're out, hopefully getting out of the bout and seeing some people. And we know that at this point in time, a lot of you may not be able to go and visit all your friends and relatives, but you still do need to get out and about at some point in time. And whether that's being out for a walk in the fresh air, or going out to see your doctor or your midwife, we do need to be able to get out and about as easily as possible.
Yeah, absolutely. So one of the ways you can get out and about is with something like a baby carrier. There's heaps of different options out there on the market, but it actually brings the baby in really nice and close to you, so it keeps them really nice and warm. It's important to double check that they're not getting too warm, especially if you're wearing a big puffy jacket or something. We want to make sure that their face is really free so that they can breathe easily. But these also free up your own hands, so that if you're out shopping or actually doing all sorts of things, these can be really handy, but they do have that added benefit of keeping your baby warm too.
And I think it is nice, especially now, I guess because we're all a little bit worried about being out and about with everyone, that you can have that little one on you. You're still able to look down, and we say that you can still kiss them on the top of their head, and then you've got your two free hands. Yeah. So whereas previously we may have been taking our little ones out and popping them into the trolleys, whereas now a lot of us are like, okay, well, I can still get out and about. My little one is contained with me, and I've got my free hands to push that trolley quite easily.
Yeah, that's a really good point, actually. Yeah.
And it's just, there are multiple different ones, whether you go for a carrier or a wrap there, but they are easy. So what we'd recommend is, when you're doing it, first of all, try it at home. Yes. I often tell people, practice at home so you're comfortable with it. Also sit on the couch when you do it first, just because, a new little one can be a little bit awkward. They move differently to what you're expecting them to. So if they are going to slip, they're going to slip down only a few inches to where you're sitting. rather than first time we go out, we're in a car park, we're trying to put that little one on, there's a bit of a further distance for them to slip at that point in time.
That's true. And a second pair of hands the first couple of times might be handy too, but you do get very good at it when you have to.
And it's just getting confident with it. And thinking about things, what I can do. A lot of people now are going out for walks with them, because it gives them that free, they can move, they can do that little bit of a power walk at that point over the different terrains as well. But just always making sure that, if you do have a puffer jacket on, maybe don't put the carrier over the top, because therefore it puffs up, and if you've got a little one in against it, it can just then encase their face there.
And you do also just have to be careful that you don't put the jacket all the way around that carrier as well. So we don't want to surround the baby with more puffy insulation, I guess. We want them to be able to breathe really freely. So it's something you kind of get used to, and you'll find your own way around that.
And it's, because most of it is just their little legs hanging out. So, wearing those little leggings or trackie pants maybe over the top of their little onesie to give them warmth is enough as what they need.
Yeah, definitely.
And always just checking on their warmth as well while you're going along. But the carriers are great there. So another thing, I guess, getting out of the house, not all of us are going to walk from home. We might actually need to get into a car, and there are options. We've spoken about car seats from 0 to 4, but there are also capsules as well.
Yes. So this is part of the systems, the car seat systems.
So this is a travel system as well. So it means that you can then have this already in your house, get your little one already harnessed in it. So while you're in the comfort of your house, and popping them in there, harnessing them in, and then just taking them straight out to the car and clicking it in. Especially if it's a little bit windy or rainy, you could put the hood up so it just stops some of that quickly going onto them, because it is awkward to hold this, have an umbrella and try and put it in all in the one. It's just nice and easy. They're in, clip them in, and then away you go. And then if you're going to the shops, again, you can clip that out and then pop that onto your frame of your pram. And it's just making sure that if you are going to look for a capsule and a pram, that you're making sure that they're compatible with each other at that point. And so it is nice and easy, and especially if you are whipping into the store just quickly, you can still just pop it on the ground while you get your bits and pieces out and there, and you know that the child is safe in there.
Yep, absolutely. They're a really great option, and they do free you up. Being able to clip that straight into the pram's a really great option.
And I know that, look, a lot of people still then worry about that. We've taken off their puffy layers when we've popped them into the car, but we still want them warm in there. So I guess it's,
just a blanket over the top's usually all that you need, and probably the little beanie hat as well. Yep, that'll be perfect.
So nice and easy. So it's just a different idea to think about.
And then if we're going to go for a walk with them in the pram, in the middle of winter, it's essential to have a rain cover on your pram. So this is a really beautiful one. Elise, what style was this one?
So this is the Steelcraft Henley. So it's a fantastic pram. It comes with everything that you need in it. You've got the beautiful bassinet for a newborn, and then you've got the seat unit as well. So it changes with the actual age of the child, but it also comes with the rain cover. So it's designed that you can still get out and about. Now the rain cover, Silver Cross. So it's a beautiful, English brand there, and that beautiful classic design of a pram. And this is a limited edition, so it does come with extra accessories with it. But when you're out and about, and if you are in the rain, it comes with that rain cover, which is fantastic. So it just covers that pram and keeps it off the little one.
And it's essential to have a rain cover in winter so that you can get out and about. It gives you freedom. They have these little holes in them for airflow as well. But as soon as you're out of the rain and into the shopping centre or back home, it's really important to take that cover back off again to improve the airflow. Just take that off there, and
so remember, it's all about that airflow to that little one.
It's really
that air
important.
Circulating around them at that point.
And then something like this. What was this one called?
So this is the little foot muff there.
Yeah.
So a little boot cover. So it's designed that you may not be wet when you're out and about, but it is chilly, could be a little bit windy. This is going to buffer that wind from going onto their legs, but it's also having a blanket, but without I guess, the blanket where it will slip off and fall on the ground and get dirty. This just fits nicely onto that pram for you.
It's almost like a raincoat for
Yeah.
the pram, isn't it? It keeps them really nice and snug inside.
And then you'll even find, like with this one, it's got a beautiful liner in it. So it's that fur feel there, and it is just divine to pop that little one on to add that extra softness and warmth to them as well.
Absolutely.
Because it's still critical that you do get out and about.
It is.
You know, you don't want to be housebound, and we know a lot of people have been. But if you can get out and about and do that little bit of exercise, it just goes for your health and well-being as well.
It does.
You know.
It's good for mum and baby and dad.
Yep.
So that one over there. And then in winter, I guess we know that a lot of babies get unwell. They get the coughs and the colds and the little snuffles. This year's a little bit different because we've got the pandemic and the concern that your baby or yourself might actually be unwell with COVID-19. So if your baby gets, you know, a snuffly, runny nose, or if they're coughing, using a lot of effort to breathe, anything like that, I guess they do need to be seen by a doctor within a couple of hours if they're less than 3 months old, especially if they've got a temperature over 38 degrees. Going to the hospital might be the best option to get immediate help. And if, say, they're a little bit older, between 3 months and 12 months, and having some of those cold-like symptoms, calling your GP and having a chat with them, and perhaps doing a phone consultation might be the best option. And in many cases, they are going to suggest that you get a COVID-19 test. And that will mean going to one of the testing facilities and following the directions to do that, and then straight home again afterwards. If it was just a regular cold though, and your babies are going to get just the cold virus, it's normal for them to get many of them every year, especially in that first year. There's some really common problems that they might have, like getting a snuffly nose that they can't breathe through very well. And when they're trying to feed, you know, babies breathe through their nose. So using something like a nasal aspirator to actually get a little bit of the snot out of their nose can work really well. You can also just use a little fingernail if you can see it there. And squirting a little bit of breast milk up the nose is also really effective at unblocking the nose, making your baby sneeze, and getting some antibodies actually right where they're needed as well.
And I guess a lot of people currently now, because one of the symptoms is fever, a lot of people are going for different thermometers as well, which is just something, I guess, nice to have at home. And we'll often recommend, you know, take the temperature of the little one when they're healthy and well, jot that down so you've got that baseline. And then when you feel your child is a little bit off and doesn't, you know, you could be thinking, are they a little bit sick or not? You've got that baseline, and then you've got that next reading, so then you can go, well, look, they have got a slight temperature at that point.
Absolutely. And anything, if it's over 38 degrees, we do assume that they have a temperature. And there's lots of different thermometers. I think we've seen plenty in the news lately, even no-touch thermometers and things. But just a simple little digital one under the arm is also really effective. And if you know that your baby has that temperature, they do need medical care, particularly at this time.
And I guess something else which Belinda has informed us about is that there is a great helpline. So it's a pregnancy, birth and baby helpline. It's free Australia-wide. It has been pinned in our little Facebook Live there in the comments, so you can grab it. It is 1800 882 436. It's 7 days a week, and it's from 7 a.m. to midnight. Now, who actually mans that phone?
It's staffed by maternal child health nurses, so you're going to get qualified health professionals who can help you with your baby. Because of the pandemic though, if they do have any of those cold symptoms, they will also suggest that you get some testing done, but they can give you really practical advice on what you can do right then and there to help your baby breathe a little bit better and put your mind at ease. They're also really helpful for a host of other issues. It doesn't have to be that your baby's sick. So it might be that you've got a feeding question, or your baby's got a nappy rash, or a whole host of other things, sleep issues, all of those things. They can give you some pointers on. So keep that number handy.
And I think that's a big thing, is that there are people out there to help you in whatever stage you're at. You know, whether it is that you're currently pregnant and you are feeling a bit overwhelmed at this point in time of what's going on, you know, do reach out and ask for that help and get that advice.
Yeah. Health professionals are all still working. They're just working in a slightly different way. So it's worth phoning the health professional that you think you need. They will suggest you moving on to someone else if it's not them that's the right fit. But actually asking how they're delivering their services at the moment so that you can get help.
And even those telehealth conferences, they'll have a chat to you and then decide whether you need to come in and see them or what the next step is.
Yep.
So you're not alone out there. They're already there to help you, so please just reach out. And I guess it's the same as what we've been talking about, different tips to get you through winter with your little one. You know, it's all about making sure that it's easy for you. You know, and you might have some of these things or similar products at home, which will get you through. And it's just then working out what's best going to help you and your situation and make it easy for you.
And I think it's a bit of trial and error. You'll use some of these products and think that's the one that I love, or it suits myself and my baby. And there'll be other things that you might use once or twice and they're not right for you either. It's purely up to you and your family and what works best.
So I guess we'd like to thank you for joining us tonight. And I was going to say if there were any comments there, but I don't think we actually mentioned that at the beginning of the session, so there haven't been any questions popped up today. But thank you again, Belinda, for being with us tonight and to give that extra little bit of information and support to our viewers.
My pleasure.
It is wonderful to have you, and I'm sure we're going to see you again in some of our future live series. So thank you again for watching us, and please, if you do have any questions, by all means jump onto our Facebook or our Instagram and pop those questions